Andrew Eborn Show. I'm joined by Dr. Marliese Symons. How are you? Thank you very much for being so patient.
Thank you very much
Well
for
done.
having me.
We love it. We love it. And also the regular on the show, Gary Anderson. Fantastic. Who brought his sister along last week?
I did, yes. Sister, grandmother, father, everybody was here.
Nepotism. We love nepotism. One thing we do love on the show is shining a spotlight on areas that people may not understand. They get misrepresented. They get lambasted, even in the media. Homeopathy.
Absolutely.
Tell me about that, because you belong to the central body.
I belong to the Faculty of Homeopathy, which is the medically qualified homeopaths, and it's an international organisation. It's been going over 150 years,
Okay.
And we are all medical professionals, but we also use homeopathy to treat our patients. And very often these patients are people who have gone through the NHS, they've gone through the system, the NHS hasn't really got anything for them, and then they turn to people like ourselves. And it works, and it's safe, and it's effective, and what's not to love?
Well, this is what I want to sort of touch on, because as you know, we've had a few people on the show from that sort of side. Traditional doctors, let me put it that way, who don't deal with that, a lot of them criticise him. Talk to me about that criticism and why you say it's unfounded.
Yeah, so, I mean, look, listen, way back when I was a student, actually at King's College, London, which is just down the...
It is down the road.
Down the...
If you can do it when the waters are not so choppy,
yeah.
get quickly, it's got to do.
I was a student, I was studying for my first degree, it was science, human biology, and I had a bit of a jaw drop moment in one of the lectures. It was somebody talking about, a professor talking about Parkinson's disease and how the part of the brain gets affected, and he said something that just made me stop in my tracks, and he said, well, we've got drugs that treat Parkinson's disease, however the side effects are so bad that patients would prefer not to take it. They'd rather just have the effects of the disease. And I was like, my jaw dropped, and I thought, how on earth are we spending billions of pounds, dollars, whatever, developing drugs, and it's not even, people don't even want to take it. And I thought there must be another way. So I looked into all sorts of things, Ayurvedic medicine, acupuncture, and homeopathy came up. And I asked my teachers, what do you think about this? And they said, oh, it's a load of rubbish. And I thought, oh, okay, I'm a science student, I'm a scientist. If it's a load of rubbish, it'll take me 5 minutes to debunk, and I'll carry on my merry way doing my science career. Only the problem was that I followed the evidence, and the evidence showed that it did in fact work. And so I couldn't ignore that.
So what was the evidence? Say, back it up with the evidence. Where did the evidence come from?
So about 200 years ago, when homeopathy was first developed by Dr. Samuel Hahnemann, a German doctor, based on the principles of people like Hippocrates, who's well known as the father of medicine. And he developed homeopathy from those principles that he observed in nature. He then tested the medicines, and over the past 200 years, the homeopathic community worldwide has used that information to treat people. And we've got a huge amount of evidence. And I think one of the biggest myths about homeopathic medicine is that there is no evidence. And look, every system of medicine needs to gather more and better quality evidence, and homeopathy is no exception. However, it is based on scientific principles, and that was a bit of an eye-opener for me. And as a scientist, I couldn't ignore that. And so when I went to my professors and said, well, you know, what do you think about homeopathy? They just said, oh, it's rubbish. Now, probably they had never looked into homeopathic medicine before. However, this one particular person, one of my tutors said to me, actually one of my PhD students is studying homeopathy. Why don't you give her a call? So I gave her a call, and she told me to read a book called The Science of Homeopathy by a well-known professor of homeopathy called George Vitulkas. And that kind of was the next step in my journey. I was like, oh, okay, this is based on science, and this is based on evidence, and it's real world evidence.
So when we say real world, you're talking about case studies, is that basically? So that's what it is. And a lot of people, and again, because they're not here, and last time we had people who were representing homeopathy, I said, let's get some people who disagree. Let's try and work out where the common ground might be, and work out if there's any substance. to the arguments against. And that's why I say it's important to look at the evidence. You're saying you've got some cases. What they might say, there's a psychological thing. And the danger is, if you stop certain people getting traditional medicine, only because you go down the homeopathy side, that's very dangerous and shouldn't be allowed. What would you say to that?
I would say absolutely, you need to work with both. You absolutely
so it's
need
working
to.
With both.
So absolutely, as a medical professional, I see chiropractic patients, and I will do an assessment, I'll do a diagnosis, there will be things that I can't treat and they need to see another specialist. And it's the same with homeopathy. There are certain things, look, if I break my leg, I want to go to a hospital, I want to get it x-rayed.
Your nettle whatever's not going to do anything for you, is it?
Interesting that you should say that, because I have many patients over the course of my career, 30 odd years, and yes, they go to the hospital, they get x-rayed, they get plastered up, but here's the thing, do you want that bone to heal really quickly? Because if you do, I've got some homeopathic medicine that will help.
So that's
so it's combining the two, and it's kind of like not throwing the baby out with the bathwater.
So look at both, and I think that's the important thing, is because people say you don't want to just go down one route, see how it might complement. Gary's a regular on the show. We haven't really spoken about publicly, and when we talked about your coming on the show, we thought, well, actually this might be the appropriate moment to talk about your own condition.
Well, Doc, I was diagnosed very recently with multiple sclerosis and other complex neurological disorders. Coming from a science background, we had a chat a moment ago, coming from a science background, unless I get a prescription, I'm not sure it's going to work. So I'm the skeptic about homeopathy. But talking to you with your science background, what would you advise someone like me to do? Because I thought I was invincible. You know, coming from the sort of career I have, I thought I was invincible. I'm now feeling very vulnerable and not sure what I need to do. I'm not sure that I want to be taking these drugs all my life, you know, because you read some of the interactions of them, you read some of the side effects of them. Not great. Also, I want to try my best to get in that environment for me to get, I'm not going to get better because you can't, I've got this now for the rest of my life. I'm not going to die of it, but I'll die with it. But how can I go the homeopathic route, and what would you advise someone like me?
So the thing about, and what I love about homeopathic medicine is that it's truly holistic. So what does that actually mean? That means that we look at physical symptoms, but we also look at non-physical symptoms. And that's something that Western medicine doesn't excel at, shall we say. You know, you've either got a physical problem or you've got a non-physical problem, i.e. a mental problem. And there's not much combining of the two. And that's what I love, not only about homeopathic medicine, but also acupuncture or Ayurvedic medicine. So, for example, very simple example, I might have a patient who has had a trauma or a grief, and they're really struggling to get over that. Well, we know from 200 years worth of experience and evidence that there are certain medicines that have an affinity to help people over trauma and grief, because there's certain signs and symptoms that you can look at. So somebody, for example, in your position might have a bit of anxiety about the future.
Definitely,
and like I say, going back to all the evidence that homeopaths before me have gathered over the past 200 years from all over the world, right? Because homeopathy is used by something like 200, 300 million people all over the world. And over the course of 200 years, we've gathered a huge amount of evidence. I mean, listen, we could all do with a bit more funding to do really good quality, better quality trials. So, you know, if the NHS is listening and the government is listening, yes,
they never miss an episode.
Right. We would like some money to do these trials because we want to help people.
You've asked for money?
I mean, I'm a clinician, I'm in practice, so, you know, I'm not a researcher, I'm not somebody who, you know, goes around asking for money to do trials. There are researchers that do that.
And they're not being properly funded, is that what you're saying?
It's not being funded at all, as far as I know. In fact, quite the opposite.
And why? Because, as I say, I talk to all sides. People are doing traditional medicine, doing research there, looking at cancer. Lots of relatives. My brother-in-law is looking at particular things on that traditional route. Both sides need to turn around and say, look, if we had enough money and you keep an open mind, we're going to learn more. As you say, from simple things, I don't know, like bees and honey, for example. If you've got hay fever, I know one of the things they talk about is honey from a particular area, that might help.
Yeah.
If you get a nettle sting, there might be a dock leaf which if you rub in, that could help.
Absolutely.
And it's not just 200 years, that's been going on all the way back in history.
Exactly.
Where you've got that sort of side. But let's look at, so research is one side.
Yeah.
Look at Gary's particular situation, where he's going through the traditional medicine.
Yeah.
He's got that sort of side.
Yeah.
You're not telling him to stop that.
No.
Absolutely, because that could be dangerous, and that's the important point.
Absolutely.
But there may be a way that you can help with the other things. Is that a fair comment?
That's
so let's look, if you don't mind.
Oh, absolutely.
Let's look at those specific things. And maybe, if you're happy to do this, why don't we do a trial to see? Because you're talking about your mood, you're talking about various other things. I know you've told me, because we speak a lot, almost on a daily basis.
A daily basis,
But you tell me you felt particularly low this week and so on and so forth.
It's getting me down. You know, I used to be a really active person, very active person, and Andrew knows that I'm 100 miles an hour all the time. My job, my magic.
And that's only when he's not doing 200.
Yes,
exactly.
So I'm a very active person, but this week, and Andrew noticed it because we not had the phone calls, and when we met up the other night at the Magic Circle, I was pretty much sitting there not doing much.
Yeah, he was out of it.
And Andrew noticed that. So I need help, and for once in my life, I've suddenly become vulnerable.
Yeah.
And decided I don't want to be like this anymore. I want to change it. So but I don't know how.
Yeah.
I could go to my doctor, get some more drugs. He'd give me some more tramadol, probably cheer me up for a couple of days.
But it'll also have side effects. So your liver's going to be really stressed from all of that. So if you were my patient, what you would do is a lot of my patients are on Zoom because they're from all over the world, and even people who are local to me, to my clinic in Bournemouth, will often phone up and say, actually the traffic's a bit bad, can we do a Zoom consultation? So we do either an in-person or a Zoom consultation. That takes a lot longer than a 10-minute consultation, but we go into things on a physical, emotional, mental level, and at the end of that consultation I will go away, I will look at my books, I will probably have a good idea about what medicine I want to prescribe, and then we start that process going forward. Now, if the NHS, for example, used homeopathy and homeopathic medicine, so much money would be saved. Can I give you an example? For example, I had in my chiropractic clinic a few years ago, a lady came in and she was heavily pregnant. She was about to give birth, probably 3-4 weeks time. The problem was the baby was breech, meaning the baby was bottom down when it should be head down first, and that's quite a dangerous situation for delivery. So what the Western medicine approach is as you get close to the due date, if the baby hasn't turned, to avoid a cesarean section, which is a major operation, we will manually try and turn the baby in utero. Right. Now, as you can imagine, this is the baby's quite big at this stage, about to be born. It's exquisitely painful for the female, for the mum to be, and there are concerns as well because the cord might go around the neck, and all sorts of problems that might happen. So the lady came to me and in my capacity as a chiropractor, and I said, well, I'm not sure I can do too much as a chiropractor, but would you be interested in taking something homeopathic? Because I know from my experience and my training that there are particular medicines where babies can turn. It's been documented over 200 years. So she was a bit skeptical. I said, homeopathy is completely safe. We can give it to pregnant mums, we can give it to newborn babies, we give it to cats, dogs, animals, plants.
Plants?
Yes, there's
you
a whole...
plants to plants?
You give homeopathic medicines to plants, yes.
That's right. It's cannibalism, isn't it?
So eventually she said, yes, okay. She took the medicine, and a couple of weeks later, they were getting closer and closer. Baby still hadn't turned, so I gave her another dose of the medicine, and within a few days, baby had turned and she had a normal delivery.
And what was the traditional medical explanation for that?
The traditional explanation?
Yeah. What would they say? If they were here now...
if they would...
What would they say?
Oh, that was quite lucky.
Quite lucky.
Over the course of my career, I've had many quite luckies
No, but that's good.
or coincidences. Now hold on, let me tell you the rest of the story.
Yes.
Because 2 years later,
yes,
I was in clinic and I had my list.
Yes.
And I recognised this lady's name. She's back again.
Okay.
Okay, she wants some chiropractic.
Another baby?
Another baby. She's, 7 months pregnant,
okay.
8 months pregnant, something like that. And she said, I'm not here for chiropractic. I've got a breech baby again, would you believe? I said, okay, should we give you the medicine? Gave her a dose of medicine, baby turned, she had a normal vaginal delivery, and mum and baby had no intervention, completely wonderful.
What I always want to do, for the interest of balance...
Can you imagine,
fantastic.
How much money the NHS would save?
What I want to look at is why they wouldn't if the evidence is so clear. So what we need is what I said to every time we have somebody on from homeopathy, we need somebody from traditional medicine as well. Work out why that's not happening, because it sounds very logical when you're doing that.
Yeah.
The reason I wanted Gary to come along, well, you're not taking him off his medicine, however bad you think the effect is, to see if there's something very simple that could lift his mood and give him a bit more energy. Is that fair?
Absolutely.
Which he may want to try instantly, because he's a guinea pig, and he could come back each time and just tell me in a week or 2 weeks' time and get you back. So he could be our guinea pig, if you're happy.
I'm happy to be a guinea pig.
Yeah. But it's not going to take him off his traditional medicine, because I don't want to do that, because that could be risky.
Yeah.
So what would you recommend that he might be able to take, which is easy, could lift his mood, give him a bit more energy, and is incredibly safe?
So here's the thing, with homeopathic medicine and holistic medicine in general, it's very personalised medicine. So what somebody experiences as, let's say, low mood or depression will be very different to how the next person experiences it. So we might have 100 medicines that are indicated for, that are well known to be something that's useful for a low mood.
Yes.
But the holistic part of homeopathy is you have to look at it like it's like a jigsaw puzzle.
Yes.
That low mood is just one part of the puzzle, right? You've got to look at the person as a whole.
Right.
Okay? And you've got to look at their background, their meaning their medical background, and even familial background.
Yes.
So what kind of diseases might your parents have or have had, or grandparents?
So you need the whole medical history.
So you
before
need
you
the whole,
can do it.
absolutely.
Okay.
You need to take, it's very in depth.
Can I suggest this? Because I obviously won't be able to do that on air. Well, we could do in Carol forever, but you've got somewhere to go. So why don't you, if you're happy to do that, behind the scenes, get whatever information you need without putting him at risk, and then to turn around and say whatever you need to do, maybe something you can buy over the counter so it's not risky, and then you can report back. Would you be happy with that experiment?
Happy to do that.
Can we do
I
that?
would be delighted to do that. Yes.
There you go. So how long do you reckon that will take?
So
will we see results next week? Because he's here every week.
Yeah,
can't get rid of him. It's one of the campaign. It's going to be good.
The short answer is it depends. So it depends. For example, that human beings are complex.
Okay.
Yeah. Things like low mood, depression. Very rarely happen overnight.
Okay.
So, in order to improve that, it takes time.
Yes.
And sometimes, I think in the Western world, we want a result now.
No, I'm happy. That's what I'm asking. What's realistic to see a difference?
Realistically, I don't know anything about your medical background. I normally say to people, give it 6 treatments.
Okay. And how long is the treatment?
And so, I normally see people once every 3 or 4 weeks.
Right.
So we're talking about that kind of thing.
So it's,
depending on
6 times 3 weeks, 18 weeks. Is that what you're saying?
So no, 6 appointments or something like that would be about 5-6 months.
I'm happy to explore it.
Let's do that. So that's fine.
Yeah.
So if we're happy to do that, and maybe in between we can report back. Is that okay?
Yeah,
be part of that program.
As long as Doc's okay with it, I'm happy to try it.
Fantastic. We're going to do that, and we will report back. We're going to have you regularly because you've got some patients and so on and so forth.
I have, yes.
I would also like you to bring some of your biggest critics, because that way, because what I'm keen on, I want to keep an open mind about this stuff. I don't want people to be put in danger. I want somebody who knows about these things to put their argument and give you a chance to respond to it, and vice versa. Is that fair?
It's absolutely fair. I mean, bear in mind, I was a scientist.
Yes.
And I was a skeptic.
I know, I understand. I'm keeping an open mind.
I
can't be fairer than that.
No.
I'm not an expert. I don't know. I can hear the arguments. I am a lawyer, so I can help eke out the arguments on both sides, and that's what I'd like to do. Is that fair?
Yeah, that's absolutely fine.
And we will find the common ground. But for now, we're hoping going to make you feel better. Get your energy
Let's
back.
hope so. Thank you very much.
Thank you so much. We're going to take another quick break. When we come back, I promise there will be a little bit more music. And do not touch that dial. I will. Oh, well, hello and a very warm welcome back.